And they can say, oh, well, they're getting paid, so, oh boy, they're getting a lot of money. I can tell you they're not getting paid enough to park the cars of the cardiologists and the oncologists who are serving in that hospital right now. Who are they kidding? If they were paying so much money for these providers, why in the world are they having such trouble getting people to staff the need? And if they say, oh, well, there's not enough providers in the population, then maybe they ought to invest, because they're Kaiser, in the kind of loan repayment programs that would attract a lot more people to provide care and go into the service of treatment for those with mental illness and addiction. But I want to thank you all, because this isn't just an issue of Kaiser. It may be Kaiser today, but it's Blue Cross Blue Shield tomorrow. It's any number of healthcare insurer. And frankly, Blue Cross Blue Shield, California, doesn't have a perfect track record of disenrolling the sickest of their patient population. And we need to address this in a more systemic way. And what I love about what your union is doing is that you're raising the flag on these issues, and it is going to continue whenever the strike is finally called, whenever these issues somehow seem to move onward. You're not going to move onward. You're now engaged for the long haul. And I am so grateful, because our country needs this kind of advocacy more than ever, and your union is showing how it can happen and what can be done when people organize. And I'm going to take that message back, just like Jim Beall was telling you all about those best practices around the world that he's borrowing and trying to put into law here in California. I'm going to go around the United States, and I'm going to say, when we look at advocacy, here's what we're looking at. And NUHW is leading the charge and showing how clinicians need to band together to improve the lot of their patients. So thank you for welcoming me out here to California. This is a tremendous state. It's the state that my uncle, President Kennedy, was elected by. It was the state my uncle, Robert Kennedy, prevailed in. It was the state that my late father, Senator Edward Kennedy, prevailed in. It's a progressive state, cares about people, and that's ultimately going to be the reason why, with your voice being raised, we're going to make sure people finally get the kind of compassion and care that the state has always demanded. Not always perfectly, but, you know, honestly, you've got a lot to be proud of coming from a state that is more progressive than many others, and that does give you an opportunity to rectify some of these terrible tragedies and injustices. And to all of you who have spoken about your own personal experiences, you are helping to make sure others do not have to go through with those terrible pain that you've had to go through, because you've been willing to put your own pain out there and tell a story. It's very painful. It's not something you wish to do, but you're going to be helping other people, because it's going to allow for the advocates to really point to these tragedies and say, can't we do better? And of course, the answer will be always, of course we can do better. And thank you all for testifying today.